Hi, this is Dr. A with part 2 of your chapter 5 of Intro to U.S. Healthcare. We're looking at population health, and this is from Basics of the U.S. Healthcare System by Niles. All right, so we are going to look at case studies and examples of population health. Okay, so the first case study is the Farm Dinner Theater. So this is a health and safety program that's in North Carolina, Kentucky, Nebraska, Tennessee, and Virginia. And it brings farmers together to discuss health and safety issues about their farm in a relaxed environment. The goal of the Farm Dinner Theater is to encourage farmers to make health and safety changes on their farm. And farmers and their families watch 3 10-minute plays that cover health and safety topics, and then they discuss solutions to the issues addressed in each. The topics can include animal handling, falls prevention, heat and fatigue prevention, tractor safety, and skin cancer prevention. The results indicated that more than 57% of the over 600 participants implemented the health and safety information on the farms, compared to only 40% of those participants who just received educational materials. So, good impact there for that program. The next one is the population health model. So it is the patient-centered home model. So it's not really a case study, it's more of a model, but still kind of a case, right? So population health models focus on both the financial and the health outcomes to produce in a value-based model. It improves health outcomes at a reasonable cost. Sometimes it even saves money, right? So because there is also a role of primary care in improving population health. And so the patient-centered medical home is a primary care model. So and it is an example of a collaborative effort by clinicians in primary care to integrate community health with accessible and culturally appropriate primary care of a patient from a family and community perspective. So in 2011, as a result of the Affordable Care Act, there were monetary enhancements for primary care in patient-centered medical homes. And research shows that these patient-centered medical homes improve quality and the patient experience and increase staff satisfaction. So this is a win-win-win right there. And also reduces healthcare costs. Bonus win. So practices that earn recognition have made a commitment to continuous quality improvement in a patient-centered approach to care. So another case study, COVID-19 vaccination and health disparities. So in 2020, a local Philadelphia newspaper reported that Black patients' mortality rates were 30% higher than white patients, and this is for COVID-19. Black and Hispanic women living in Philadelphia were being infected at a rate more than 5 times that of white women. Despite these rates, people of color received vaccination at a lower rate. So the local hospital, the Thomas Jefferson University Hospital, developed a model to address these disparities. So its goal was to focus its vaccination efforts on or towards people of color. So it launched mobile vaccination units to underserved geographic areas, which then increased vaccination rates. So sometimes people don't do it simply because they don't have access to it. It's not nearby, it's not convenient, right? Then as a result of this success, the city asked for the Thomas Jefferson University Hospital to expand its geographic area. In April 2021, Jefferson implemented a citywide mobile vaccination effort. These efforts resulted in a vaccination rate of 80% in the people of color population. The hospital also communicated with the local community leaders regarding the plans so that these leaders could convince their citizens of the importance of being vaccinated. So this is an excellent example of a population health initiative, especially getting that community buy-in, getting the leaders involved so that the message can be spread to the community, so that when the vans like they're bringing the access to the vaccines arrive in the community and they have the opportunity to go get vaccinated, they do so, right? Population health goals are partnerships with healthcare systems, agencies, like public health agencies, right, and community organizations that focus specifically on health outcomes in designated communities. So this one, the health outcome was to increase vaccination rates so that we could decrease mortality for COVID-19, and the designated community were people of color in that Philadelphia area. So there's a tool also that's called Pathways to Population Health Compass. And the purpose of this effort is to create a framework for health organizations to organize their population health efforts. So it's an electronic assessment tool, which takes about 20 minutes to complete. It has a compass to guide, because compass guides you, right? That enables organizations to self-assess what their current state of the organization's population health efforts are, according to 4 portfolios, which will be listed on the next slide. And there's guidance then on how to create different components of a pathway to population health in each of those portfolios. So portfolio 1 has physical and or mental health. And there you have team-based care, behavioral health integration, and care management. In portfolio 2, is the social and spiritual well-being portfolio, and this one has screening for social determinants. Portfolio 3 is all about community health and well-being, and this one is where you build community partnerships and benefits. And portfolio 4 is communities of solution. This is where you can leverage innovative solutions and policies, which can then change things. Really cool. And then we need to talk about big data and population health. So the concept of big data has evolved since the 1970s, but really took off with the introduction of social media. You know, it took off with the internet, but then it really took off with social media. And along with social media, with the smartphone usage, really, really greatly increased data. And so, social media tools such as Facebook, YouTube, now Instagram and Snapchat and TikTok and all of the social media tools, businesses realized that there were huge user data sets that could be used to analyze user preferences, to track where they were going, what they were interested, what they're looking into, to target ads also to them, right? But the introduction of these tools to analyze these large data sets encouraged then more use of big data, because then it was useful and could help grow businesses. So the term big data refers to huge data sets that have 3 characteristics: volume, variety, and velocity. So volume refers to the amount of data stored, so lots and lots and lots of information. Variety refers to the types of data stored. And velocity refers to the amount of data that is received and how fast it is analyzed. So how fast it's moving, can you get real-time data and analytics of your big data. And so, of course, healthcare generates tons of data. Of course, the thing is that healthcare data is protected. We have privacy laws there. So, we have safety issues also with the collection of big data and sharing it. But once you de-identify data and you gather it into big pools of data that are de-identified, and you don't have the privacy problems anymore. And so that's a way you can really leverage big data, is to do it at a clinic level or healthcare facility level. So some examples of big data and population health. Flatiron Health uses billions of data points from cancer patients to expand research and improve patient care. Pieces Decision Sciences is a cloud-based software company from Irving, Texas. They collect and analyze patient data to develop recommendations to further enhance patient diagnoses and treatments. So that's almost kind of like a clinical decision support system, kind of, that thing. So again, there's a lot of data being collected all the time. We need to be able to leverage this. Somebody I know did a study within their larger reference lab. So they cover a large region, and they were looking at different clinics and with their population of diabetic patients, like how many patients in each of those clinics that had diabetes had at least one checkup a year with an A1C. and then targeted the clinics that had really low numbers, low percentages of these to increase their reach to their patient population to get them in, to get their A1C and get their follow-up checks. So that, again, but they use big data to capture the picture first. So in conclusion, population health's goal is primary care delivery with an emphasis on health outcomes of a designated population. Could be geographical, could be a disease-based, could be a type of person. The goal of improving an individual's health status will improve the overall population's health status. So each individual's health increases, the population's health will increase. The most popular population health model is a patient-centered medical home, which is used across the country in primary care settings. The chapter also highlights the farm theater in the Jefferson Hospital case studies, which illustrate the population health models that focus on working with community partners to improve their health by non-clinical initiatives. So the farm dinner theater focused on health and safety education for farmers, and the Jefferson Hospital focused on primary prevention by increasing vaccination rates. Finally, the use of big data can be very helpful in population health because the volume of the data, which can help focus on different interventions in different communities. And so we don't waste money. Okay, so that wraps up our population health chapter. I hope this was a fun and helpful lesson for you. Thank you.